Tonight on 7 UpFront, an update on the Omicron variant with an infectious disease epidemiologist as the world confronts this latest challenge in the ongoing COVID crisis. ICU beds and hospitals across the state are filling up with COVID patients. The most recent data from the state showing some facilities nearing capacity. Right now, more than 1,000 COVID-19 patients are fighting for their lives in Michigan intensive care units, and emergency departments are seeing more than 2,000 COVID patients a day. Joining me tonight is Dr. Emily Martin, an associate professor of epidemiology at the University of Michigan School of Public Health. Dr. Martin, thanks for being there tonight.
Thank you for having me.
Let's start with this new variant. Michigan's first case was reported in Kent County. Are you aware of any other Omicron cases in Michigan?
I'm not aware of any other ones in Michigan. The current count from the CDC has over 30 states are currently seeing Omicron cases. It does take a few weeks for data to come in and for the processing of samples to happen. So I wouldn't be surprised to find out in the coming days that we have more both around the Midwest and around all states of the U.S.
In layman's terms, how quickly are you able to study and reach conclusions when it comes to a new variant like Omicron in terms of its spread as we continue to deal with the Delta variant that's been here now for months?
So some of the earliest data we're able to get is in terms of spread. And the data from the UK seems to be really indicating that it spreads about twice as fast as Delta that we've seen before. Now it's going to take more kind of days and weeks as we get into understanding the match with the vaccines and things like severity of disease, but we are starting to get some early signals from data in other places.
So how concerning in your mind is this then for our state and for the country, for that matter, as we've reported with so many hospital systems at or nearing capacity with COVID patients? Absolutely.
So, in a state such as ours that has one of the highest case rates and real pressure on the hospitals, even if something isn't as severe, but it's spreading twice as fast, that can translate to a lot of hospitalizations. So I do think it's a very real concern if this takes off in terms of pressure on our medical systems.
And I'm reading today that a doctor in Ontario, Canada, says Omicron cases there are doubling every 2 to 3 days. National Hockey League has canceled a number of games because of increasing infections to vaccinated players. I mean, if that's any indication what we're in for, that's frightening.
It is true. However, the data is starting to come out of the UK to show that 3 doses of vaccine is providing the best protection against Omicron. So we do have options to bring up our vaccination rates, use 3 doses, and protect that way. We are seeing a lot of reinfections with Omicron from other countries. And so that's just reiterating the fact that vaccination is going to be the best way to build up immunity against this one.
Any other precautions that we should take as well?
I think going into the holiday season, we're all going to have, gatherings, visiting with loved ones. And so I think continuing to, use other measures that we have. So rapid tests are becoming more frequently available, and they do work to detect Omicron just like the other variants. And so using testing when we can, and spacing out our gatherings with each other as much as we can will slow this throughout the holidays.
Masking still important as well.
Absolutely. Masking works just like it does with the other variants. It works for Omicron as well.
Doctor, thank you for your time tonight. We'll leave it there, but much more on this subject and COVID in general. Thank you.
Thank you.